Every Wednesday, Florida 24 will bring you the latest tips and tricks on how you can stay healthy. We are speaking with health experts across the state to discuss some of the most important wellness topics each week. This week, we are talking about bariatric surgery as many people kick off their weight loss goals for 2022. I sat down with Dr. Zhang, who tells me 1 in 3 residents in Florida is considered obese. He explains how to determine if surgery is right for you.
What makes someone a good candidate for bariatric surgery?
The current standards for bariatric surgery right now is if anybody with a BMI with 40 or above, which puts you at morbid obesity or class 2 obesity. And then if you have a BMI of 35 or above, you need to have a medical condition associated with it. Usually this will be high blood pressure, high cholesterol, sleep apnea, or diabetes.
What are some of the reasons why someone can lose weight easily through diet and exercise and other people may be struggling? Is there something that's kind of in your body composition that would make that different for someone?
Yeah, I mean, the reason we offer bariatric surgery is for these select patients, there's hormonal changes. A lot of it is genetics. You'll see most of these patients, there's a strong family history of morbid obesity and cardiovascular disease. The other thing is bariatric surgery is a metabolic surgery. So not only do we sort of change the anatomy, we also change a lot of the hormones that control appetite and hunger.
After you determine a patient is qualified for surgery, after they get that surgery, what kind of results can they expect?
Once you have surgery, it's not like your condition's automatically cured. What we really provide through surgery is a tool for the patient to sort of reset their lifestyle. So what the surgery really does is in the first 2 years, really regulates how the patient can eat. Basically, it doesn't let the patient do any of the poor behaviors like overeating, eating too much sugar, eating too fast. So it basically keeps them, it basically shows them how they're supposed to do things. And the goal for the patient is to use the surgery to adjust their lifestyle.
Dr. Zhang says the pandemic has played a big role in many people gaining weight. He adds it also helped people realize how important maintaining a healthy weight is because people with underlying conditions are at a higher risk of COVID complications. For more information on bariatric surgery at Broward Health, visit browardhealth.org.